Hi, Dr. Christine Rankin here, getting back to you from South Metro Wellness Clinic. Today we're going to talk about a different kind of report of findings, one that takes place after a patient has not had a quality experience or does not feel better after their first adjustment. It's important to remember that 40% of the time a patient can actually feel worse or have more pain following a first or a second chiropractic adjustment than they will having absolutely no symptoms or feeling like $1,000,000, as I like to say, for the folks in the 35 and under crowd who have not had enough years to accumulate pressure, pain, and other damages. In this specific case, the patient was a 50-plus-year-old male. He had been struggling with low back pain and right leg pain for over 10 years. He attributed the majority of that to a lot of wear and tear, hard work, stress, and not really putting any wellness back into his body, which is what happens. Just like running a car on parts that need to be repaired or replaced or running it out of gas. You wouldn't drive your car that way and not take it to a mechanic and expect it to work, at least not if you're a responsible person. But a lot of times we can trick ourselves into thinking it's okay to work ourselves too hard and not put wellness back in and think that it will go well. It gets to a certain point where, as in this gentleman's case, 10 years later, he's living with pain and it just isn't working out for him. His first adjustment after his exam went swimmingly. Everything worked out well. He adjusted quite well. I was actually a little bit surprised to see that we didn't have to fight through so much stiffness to get his spinal segments to move appropriately. The next day, he didn't feel well at all. His wife was terrified. They get on the internet, start looking for what do we do, what kind of resolution do you have if you had a bad chiropractic experience. All she knew in that point in time was her husband was in pain, but now he's worse, and the only thing that changed was his visit coming here with me. So we had to go back and explain why these things happen. And it's not because something went wrong, it's actually because something went right. Over a 10-year period, this gentleman had a ton of nervous system pressure and, yes, developing damage right here at the L3 segment and the L5 segment. This was putting a constant amount of pressure, which was building over a period of 10, if not closer to 20 years, on the nervous system and in these joints for that period of time. As a result, these nerves come from the low back spine here, and they go down into the legs, and there's these large trunks. Okay, and so when you take pressure off of these nerves, they do this thing called despierta. They wake up, right? Okay, so this couple was speaking in Spanish, so this is a completely different approach here. We had to keep things very simple, but the term and the concept went very well. We had to take pressure off of these nerves, let these legs wake up, and when the pain started, it was because the adjustment was wearing off. The adjustments are good for 24 hours at best after a first time. They don't last any longer than that. In severe cases, you may only get 6 or 8 hours of relief. The pain will come back. When pain comes back, it's perceived in our mind as stronger than what it was in the beginning, and it changes our perception. So the pain comes back, and it was extreme down in the legs, but his leg was structurally perfect. His knee was structurally perfect. He could walk, he could balance himself, he could move his knees, he could move his feet. There was absolutely nothing wrong. But the pain was very, very intense. So going back to what happened, he wasn't fine, but he wasn't in this serious of a situation. So this gentleman's perception of pain also played a role in why he was thinking that he had actually gotten worse. The patient also admitted to not stretching after his appointment and also not probably using any ice packs. So it's important to use some ice to take some of the inflammation down and stretch your body each day. He admitted to doing neither one of those things and used pills to help reduce the pain and power through another week worth of work, which is, as we talked about last night, part of what got him into that situation in the beginning. So I would highly recommend, whenever you come in for a first chiropractic adjustment, if at all possible, don't let that whole entire week go by without talking to your doctor, because if you do have a negative experience, you're going to end up harboring all of that pain and confusion for the entire week versus getting in the next day or within 48 hours, which is typically our general rule here. So this patient had a lot of risk factors. There was too much time that had elapsed from his first adjustment to his second. He had no additional therapies, used medication to cover up the pain, continued to go back to work and do everything that put him into that situation, did not rest, ice, or stretch adequately. These are the types of things that can also contribute to having a bad experience if you're not 110% prepared for the experience, or you just didn't know what to do. I told this individual After we talked about why his pain came back, because the nerves woke up as we took all the pressure off, the best thing you can do is to continue with your treatment. If you can't continue with the treatment consistently, I said, don't do it, because you're going to put yourself at a bigger risk of having more pain. I obviously didn't want to leave him in that situation. He and his wife knew better. And once we talked about the nerve distribution and actually how important the nervous system is and what role it plays in helping things, it all made a little bit more sense. Patient was happy. He got another fantastic adjustment. He felt pretty good, darn good leaving our house last night. I'm going to call him today on my honor. Hope he's doing okay. Working 14-hour days probably isn't the best thing to do, but you can't tell a man not to work, right? Doesn't work out that way. So the most important thing is we got a chance to go over his back was in better shape. The pain in the leg was serious, and it was all because his nerves were responding to a new normal. So when your body goes through these adjustments and it has to figure out what to do, our goal is to help reduce those risk factors and help a patient understand that if and when they are serious about getting chiropractic care and doing therapy correctly, your frequency, your timing, and your follow-through is absolutely everything. Because if you're not able to do that, your body won't recover. The treatment plan is the treatment plan for a reason, and it works. And if you do have a bad experience, it's extremely common. It's extremely common to feel worse before you feel better. I'm here to help support people get over those humps so that they can reach their goals and actually have better health in the end. So, with that, that is what happens when you have a tough report of findings. It was a stressful day last night. But anyway, our patients here are actually doing very, very well. And he's not the only person who's had a tough time with this. We do need to go over it here and there because Jerry had forgotten to talk about what happens when you have a bad experience, because we had so many people who were having good experiences that I did want to go back and go over this one because it's important. Every patient matters. Every case is important. Every person matters. And yes, it is very common to not feel like $1,000,000, especially if you've had a lot of years to accumulate damage. So with that, we're going to be back next week. It's been fantastic chatting with you guys. Hope you have a great week, and we'll see you next time. Thank you.